Good day, viewers and listeners, and welcome to the COVID-19 update for today, April 4, 2022. I am Shania Gonzalez. Today, Minister of Health Dr. Frank Anthony will be revisiting some common questions asked about the transmission of the coronavirus.
COVID-19 transmission is really done when someone who is infected with COVID sneezes or coughs or even speaks to somebody who is not infected. And if that person is not wearing a mask, then those viral particles can get into their mouth or nose, and once they breathe it in, the person would get infected. So that's why, to interrupt the transmission, it is very important that we wear masks. So the COVID, there are two basic things that we got to look at. One is droplets. So when you sneeze or cough or talk, there are droplets that will come out. Those generally tend to travel for about 6 feet. And that is why we say keep a distance of 6 feet. Even if you're outdoors, you can get infected. But definitely in an indoor setting, if it's not ventilated, there are higher chances because the concentration of viral particles will be much higher. And that's why you have to take even more precautions when you're indoors. Well, a couple of things. First of all, you can make the indoor venue safer if you have ventilation, meaning that you should open the windows and make sure that you have air flowing in and out, and in that way you would reduce the concentration of viral particles if somebody is sick. So that's one way. Secondly, if the persons who will be meeting indoors, if they comply by using masks, for example, that's another good way of reducing spread. Asymptomatic does not mean that you don't have the virus. Once you're infected, you can manifest the disease differently. So some people will have a milder form, which means they don't show much signs or symptoms. So that group of people would be called asymptomatics because they have no symptomatic signs of the virus. So, but they would also be infected. You probably wouldn't know that, but they have the viral particles in them. So if they come into contact with somebody, they can infect that person. So asymptomatic people do transmit the virus. So again, we have noticed a trend, a downward trend, where people are not coming to be vaccinated. So right now it's a big struggle to get people vaccinated. You're not going to be protected if you don't get vaccinated. So I just want to keep repeating that point. First dose adult, right now we have 438,399 doses administered. That's 85.5% of our adult population. Second dose is 337,197 doses. That's 65.7% of our adult population. In terms of 12 to 17, we have administered first dose 34,324 to this age cohort. That's 47.1% of the age cohort. Second dose, we are 25,037 doses. That's approximately 34.3% of this 12 to 17 age cohort. And booster doses, we're right now at 58,820.
You have been watching today's COVID-19 update. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez.